historic inequities and historic disparities that still continue to this day, that differentiate communities and groups of people and impact and create epigenetic scars that never truly heal, that just scab over. And those epigenetic scars are such a hurdle to building equitable understanding of healthcare. And there is no way somebody from outside this lived experience, outside this lived reality, can come in and fix it. I don't think that's how it works. And I think any attempt to do that will essentially, silence the very people that we are trying to empower.
Hey friends, welcome to Public Health Careers. I'm Amari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Hridith Sudev. Hridith is founder and president for Colectivo de Paz. Hridith is interested in solving real-world problems with a special interest in healthcare policy and community health disparities. He has 12 years of experience in healthcare, community engagement, and population outreach, and over 5 years of experience in executive leadership and organizational power building. He is Oman's youngest TED speaker, founder of the nonprofit Colectivo de Paz, and a published writer and poet. He conferred a dual Bachelor of Arts in Public Policy and Bachelor of Science in Biological Sciences and Psychology with a concentration in Neuroscience from the University of Denver, then a Master of Public Health with a concentration in Community and Behavioral Health from Colorado School of Public Health, and in 2014 was awarded Colorado Public Health Association's Emerging Leader of the Year Award. In today's episode, you'll hear and learn more about how Hridith's experience in Oman and as a third culture immigrant shaped his perspective on life, public health, and his approach to this work. You'll learn about the amazing work Colectivo de Paz is doing to improve access to resources for underserved communities and advocating for them. You'll learn about how community organizing is essential for addressing health disparities, how public health is about creating systems for collective well-being, why we need to center the voices of the most marginalized communities in our decisions, and much, much more. Be sure to hit that subscribe button and enjoy today's episode.
Hey, this is Hridith Sudev. I am a public health scientist and a community organizer, and I'm the president of Colectivo de Paz in Denver, Colorado. And you are listening to Public Health Careers.
Hridith Sudev, welcome to the show. Very excited to hear more about your journey and learn more about how you got there. So jumping into things, how do you identify and tell us a little about your personal background?
Yeah, thank you so much for asking. I use he, they pronouns, and I'm South Asian. I am actually Indian originally, but I grew up in Oman in the Middle East, which is also a very interesting story if you're interested. But I am a third culture immigrant, and I moved to Denver, Colorado, in the United States in 2018. So this is my third country that I've been living in. So yeah, that's a little bit about my personal background.
Well, I love that. I don't know if you know, but I lived in Oman. I did my last 2 years of high school in Oman.
In Oman?
Yeah. At
So that's why you were smiling.
Yeah, that's why I was smiling, because I know a lot about Oman.
Oh my God!
My family lived there for like 7 years in Muscat.
In Muscat?
Yeah.
I grew up in Salalah.
Oh, really?
Yep.
That's awesome, man. I don't meet many people who grew up there. We could definitely connect on that. But I would love to hear more about how that and being a third culture kid has like tell us more about that experience. Indian, growing up in Oman, then coming to Denver.
I mean, you probably have a little bit of perspective then, but growing up, when I first moved to Oman, I didn't speak any Arabic. I didn't speak any Arabic. I speak Malayalam, which is my native language, and I didn't speak any Hindi either. So, and I barely spoke any English. So I was 4 years old when we moved to Oman, and kind of growing up there, I went to a school that was very mixed with a very large Omani population, but also a lot of Indians and Pakistanis and people from the Philippines and Sri Lanka and all sorts of places. As you were probably familiar, that's how we are in Oman. And I grew up, I would say, with a great appreciation for all of the different ways we look at the world. And it is something that is so integral to me because I am from, I'm from a very different culture than the one that I grew up in. So I would,
Mhm.
outside of my home, I would be playing football or soccer, I should say, in America, but we call it football. You play with your feet using a
Football,
ball.
football.
So, I'd play football on the streets with my friends who spoke Arabic, and then I would be going home and I would switch to Malayalam. And so, the my brain works in three different languages at the same time. My mind like speaks to me, like my internal monologue is in so many different languages and so many different ways of looking at the world. And I think that plays a big part in the way I approach healthcare, my career, but also the way I just am as a human being, because there are so many parts of me that don't reconcile. They're all their own unique, independent, uh, autonomous beings, essentially, that kind of come together to form I would say, at least to me, a beautiful whole, something that's larger than the sum of their parts. But yeah, I think that is part of being third culture. That is the pro of being a third culture immigrant. But the con is that I don't know where home is.
Mhm.
Home for me, I is there's a line in a short story I wrote a long time ago that we carry our homes with us,
Mhm.
that we are nomads of the wind. We carry our homes with us, and that's something I often think about, because I make my home wherever I go. Because I don't know, if they ask me what my hometown is, I would probably say Salala, even though I'm not Arab or I'm not Omani. But and I could also say Kerala in India, even though I barely grew up there. Or I could say Denver. I've been living here for the more than half a decade now, and I've been uh, it's been pretty much home for me. So I could say all of these different places are equally home to me. And that's something that is beautiful and also kind of bittersweet in a way. And I grew up, I don't know what time period you were in Oman exactly, but I grew up as the Yemen war began. And I lived in Salala, which is, just a handful of
Mhm.
miles from the border. So that's another huge part, because even though we've lived in the relative stability and safety of our community in Oman, um, I I remember, my dad. He is a he's a homeopathic physician, so he's like natural medicine, and some of my earliest memories are him uh, helping out on first aid drives and community organizing work. And my mom, she is a teacher, but she's also a community, she's very active in our community, so helping out with, as the waves of refugees were coming in, and people my age, kids I went to school with, growing up, kind of witnessing something that was so defining for our generation in the Middle East firsthand, and seeing the horrors, and the contradictions of something like a war, in such an early formative year of years of my life, and seeing how healthcare really gets strained and pulled apart, as the human experience starts having that push and pull of the human experience. That's something that again influences the way I look at the world and look at my career. So all of these things, I'd say, play a big role, and none of this would be like Oman is that focal point for me. Where all of these things come together: the good, the bad, the crazy, that make me who I am, that make me, help me see the world the way I do. And I think Oman is that focal point for me. And being a third culture immigrant and growing up where I did when I did is that focal point for me.
Absolutely resonate with so much of that. Me moving to Oman, living in Oman, experiencing Oman has really shaped how I approach a lot of how I see the world, and I think broadly how I see public health and how I came to want to do this type of work in a lot of different ways. But really really grateful for those experiences, and I could only imagine, because I like for people that don't know, I live in Muscat, Oman, which is like more north, more close to like the UAE, and then Salalah is on this more southern part, which is really close to Yemen. And I remember during that time there was the Yemen war, as you're saying, and there was a lot of famine and like a
Hmm.
lot of public
Hmm.
health crises that
Yep.
have happened because of that, and it was really sad and horrific to think about that at that point in time. But
I
you go ahead.
sorry, I didn't mean to interrupt. But it just reminded me, I always say that didn't choose public health. Public health chose me. Growing up where I did, seeing the public health crises is what's kind of set me on the path to healthcare. And also seeing how Oman was so, uh, had for a country that is so small and so not diversified in terms of healthcare infrastructure, the fact that Oman was able to um, be flexible and robust enough to adapt to these very difficult public health crises and very difficult circumstance is something that is as a model I look to sometimes to learn from and improve on as well.
And before I move on for Oman, just like big shout out to Oman. I think like if you do have the opportunity to go to the Middle East, highly recommend go to Oman. You'll be pleasantly surprised by how gorgeous the place is, how welcoming the people are, how tasty the food is.
Hmm.
So that
Hmm.
there. But moving along a little bit, and we'll get to this in your journey and a lot about in your role. But you spoke about organizing, so maybe talk to us about the importance of organizing. How did that come up for you, and how does that like play an important role in public health?
Of course, yeah. So, my I come from a very socially active family. Even when we were facing a lot of difficulty and socioeconomic stresses, my parents were very particular about giving back and staying connected. And if you, I mean, you growing up in the part of the world that we both did, community is a huge way of looking at the world and interacting with the world, right? It's a lot different from how we see ourselves as individuals and as members of the community in places like America, because in my part of the world, especially in southern Indian culture, you are a member of that unit. You are, your whole village, your whole town is a family. You look after each other, right? And my grandfather was a community organizer in India. He played a very, he was a frontline organizer in a lot of the labor organizing and community organizing back just after India got its independence, as we were transitioning into a democracy. He learned and worked and sharpened a lot of those skills. I would say in the public space, and he passed that on to my mother. Both my parents are very involved in community, so I grew up with that perspective. I grew up with the perspective of staying connected, staying involved, looking after one another. And when I came to America, and kind of came into my own as a public health professional, and as a younger professional as well, as I was learning the ropes of healthcare and healthcare access, as I witnessed health disparities and started contemplating on health equity and health access equity. One thing I really noticed was that there's two parts of this, right? There is a systemic part of this that has all of the infrastructure and the structures that are required for building a robust, more equitable healthcare ecosystem, but also that carries so much burden from the historic inequities and historic disparities that still continue to this day, that uh, differentiate communities and groups of people and impact and create epigenetic scars that never truly heal, that just scab over. And those epigenetic scars are such a hurdle, such a hurdle to building, an equitable healthcare understanding of healthcare, equitable understanding of healthcare. And there is no way somebody from outside this lived experience, outside this lived reality, can come in and fix it. I don't think that's how it works. And I think any attempt to do that will essentially, silence the very people that we are trying to empower. So it is absolutely important that the people who are the most disenfranchised, who have the most hurdles to health access and health equity, and any access and any equity for that matter, those are the people who should be involved in liberating their own communities. And those are the people who should be equipped with the skills and tools and systems and structures to advocate for themselves, to have the power to fight for themselves. And the way to get that, to go from A to B, is organizing. Organizing is the tool to take something that should belong to all of us and make sure that it belongs to all of us. Organizing is mobilizing people to stand up and help each other stand up, stand up and raise their community up with them. And I think that perspective of, I have a professional career where I'm working on, my public health work, and then in organizing it's a little bit more dispersed. It's not specifically just health or medicine. I'm working on homelessness. I'm working on food security. I'm working on the school to prison pipeline. I'm working on raising the floor for children who are being prosecuted as adults. And I'm looking at all of these different issues that at first glance someone might not think are related to health, but all of these things are the burden that is placed differentially on communities, differentially on people, individuals, families, that prevent them from being able to advocate for their own rights, both in healthcare and in other areas, that prevent them from being able to reach and access these systems that cause these disparities. So organizing is that crucial puzzle piece for me, from connecting from A to B, taking the ability to advocate for oneself and giving it to the people. So mostly democratizing the self-efficacy. I think that's a good way to put it. It democratizes self-efficacy. And so that's how I think, even in places where I'm not actively organizing, I'm always thinking like an organizer. That's how I approach public health. Because the findings that we come up with in our when we're doing a mixed method analysis or like community health assessment, the what we find out, our findings, they are no use to anybody until the people can use those findings to make a better health system for tomorrow. And that's that puzzle piece there.
I appreciate that answer, and I'll go one further in saying, like, we need those people to be a part of the solutions, and I think, like, to your point, is how do we continue to center those voices that have been unheard, that have been most marginalized, that haven't been
Mm-hmm.
given space, time, capacity to voice their concerns, their needs, and really be on those platforms. And I think that is the essential job that we have to do to get to, like, self-realization, not only health realization,
Absolutely.
but self-realization. So greatly appreciate that as well. That was awesome. And I guess along those lines as well, like, what does public health mean to you?
Public health. Well, I health, is one of those things that is very interesting to define, because health is such a multi-dimensional vector. What does being healthy mean? There's the medical, the physical part of it. There's also a psychological part. Then there's the social, the economic, you know, the social, the economic, the political, the parasocial. So all of these different ways of well-being, I would say. So public health for me is the systems that we create as a people that allow us to attain that well-being collectively. So, how do we collectively attain that well being? Is the question that I think public health professionals have to answer every day. So, I think that's what public health means to me: is how can we be well as a people?
And I like that guiding question as well. I think it really does help us to continue to frame, like, we are doing this for the benefit of the population, to really try to work to improve that.
Mm-hmm.
So Appreciate that. I appreciate this conversation, and I wish I could just like dive deeper into like Oman and just organizing with you because I've been enjoying like digging that apart, but want to dig into more of your story. So I know that you got your Bachelor's of Arts in Public Policy and Bachelor's of Science in Biological Sciences and Psychology with a concentration in Neuroscience from the University of
Mhm.
Denver. Walk us through that process, moving from Oman to Denver. What do you do? And then how was the decision to choose and get this bachelor's degree?
Yeah, so I never imagined that I would come to America, that I would pursue, um, a higher education in the U.S. This was never part of my plan, and I was exploring ways to kind of find the skills. So as I mentioned up top, growing up in Oman, something I noticed was that we have a very robust health system. That for a country that
That's
again
real.
has very little in terms of I would say infrastructural diversity, is still able to access, is still able to bridge so many gaps, is still able to meet so many people where they're at. And I really admired that, but I also wondered what could better look like, and that's something that I always wonder. And grow and seeing the environmental stress, that public health crisis that I was experiencing growing up, in high school, when the Yemen war started, and high school and middle school, seeing that environmental stress as an environmental and thinking about environmental justice, right? As new people were coming into Oman, and as there was a little bit more stress on resources, uh, thinking about equity in terms of access to safe drinking water and healthy air, and a clean environment. And that's kind of how I got into healthcare, in terms of professionally. It started with a little bit of environmental work in 2012. And I think it's on, I see that on your questions as well. 2012, I organized a group of young people in my community into this environmental action group called Project Green World International. And it was so initially it was called Project Green Oman. It was this group of young people who came together, advocating for environmental equity, environmental justice, sustainable solutions for the public health crises that we were facing at that time. And it was actually very, very effective. A lot of people found it very intriguing that these a group of high school and middle school students, and these young people were out here, writing zines and talking to policymakers, and organizing, and collecting signatures, and hosting events. And it had never been done before in Oman, and that generated a lot of conversation. And I think seeing how beneficial that was for a lot of the people that I grew up with, seeing the impact it had on my community, and seeing the work that we were doing in Oman be replicated across the Middle East, and in some parts of Africa, in Ghana, and in Sierra Leone. We had a few friends who were co-conspirators who were trying to replicate the work that we were doing in Oman there. And we had some folks in Bahrain, we had some folks in India as well, who was doing similar work. And eventually we all kind of came together. We started discussing. That's Project Green World International. That's when we started calling ourselves that. And they were, even after I left Oman, young people who were there were still working on that project. And I think still they're still around. But it was a huge opportunity to found something like that kind of grew much larger than myself, that I'm no longer involved with them. But the incredible work that they have done for the last so many years, and to be part of that initial conversation, the dialogue, the origin point of those ideas, to be there to see that. And like I said, public health to me is not just about preventing diseases, right? It's about creating a society where there is justice, equity, compassion. They're woven into the very fabric of our lives. And, we can address these disparities that are often rooted in systemic inequities through a holistic approach. And I realized that as we were doing, it's organizing is one thing, right? But I don't have the scientific or the technical expertise to do anything with the organizing. I don't know that the theoretical framework to successfully organize beyond my community into something that's larger, into something that's more sustaining. And that's where I realized, I wanted to pursue, go to college. I wanted to go to college. I wanted to do something that was more rooted in the science of it. And I was very lucky. I got offered the Chancellor Scholarship from the University of Denver, and there's no way I could have, come to America and pursued a higher education without that. So I was very fortunate to have that opportunity. So when I got that opportunity, I was not gonna look a gift horse in the mouth. I was like, yeah. So if I'm gonna get that, let's see where that goes. So I came to Denver. I had no expectations. I was thinking, I'll finish my undergraduate degree, I'll go back home. But then I came here, I fell in love with the city. It's such a beautiful place, such beautiful people. I met my best friends here. I found a family here. I met my partner here. I fell in love here with the city and with her. So it's a it's one of those junctures in your life that you did not see coming, and then you're there, and then everything is different. And so coming to Denver, I would say, like, I was not planned, but coming here, I came here to get the skills, and get the technical expertise that could improve my organizing. But Denver changed me so much that, it's so much more than just organizing now. It's a discipline for me now. Public health is a discipline for me now. And Denver did that. So I came here because I got a scholarship, from DU, University of Denver. I got a Chancellor Scholarship, but then I stayed because of the city.
Love that, man. Love that. Love that. Denver is a beautiful city. I love your like doing this work in Oman, this organizing work, this like fighting for things that are important to you all, and like seeing what impact that can have, and wanting to not only see, okay, yeah, they're doing this, but why is this working? Like, what are the ways
Mm-hmm.
that we can make this
Mm-hmm.
more effective? What are the ways that we aren't doing that? And figuring out, like, okay, I'm going to get an education to better understand that. And in doing that, I guess, as we all do, we get more experiences, and our careers or like vision for what we can do in this role, or what we are made here to do in this role, kind of changes. So looking forward to hear more about that. So during your undergrad, I
Mm-hmm.
know that you had a physical therapist assistant internship.
Mm-hmm.
You were a sustainability lead coordinator at the University of Denver Center for Sustainability, and you were also co-founder and executive director at the Multicultural Alliance and student trustee at the University of Denver. So walk us, along with some other positions, you were also health equity initiatives and strategic planning coordinator for New Gulf Optical and Ophthalmology Foundation, crisis hotline advocate for the Blue Bench. And then I'll get into the last one there. But like, tell us, walk us through those experiences, maybe highlight some of the things that were most pivotal for you as you were developing into the burgeoning public health professional you are today.
Thank you. Yeah. I mean, they were all so different and so integral, in their own ways, right? I was trying out a lot of different things. I wanted to understand and work in healthcare in from as many different perspectives as I could. And the public health, the physical therapist internship, I had to do, volunteer at a nonprofit my first year of college. And I was looking at things I wanted to do, and I saw that there was this opening for a physical therapist internship. It was an unpaid internship, and it was at the Craig Hospital, which is a physical rehabilitation focused hospital here in Denver. And that's never done something I'd never done before. I just tried it out, and it was so fascinating because I got to work in, I would say, in a lot more direct care role than I do now or I have done before, or since. Right, I got to work, actually, physically on people as a physical therapist assistant, and that was a very intriguing experience. The sustainability lead coordinator I was doing, so it was an on-campus position that opened up. I am not somebody who sits still. I jump around. I love being busy. It's my favorite thing to do, actually, if I'm going to be honest. Staying busy and just exploring. I'm very ADHD. I know I'm very ADHD in my life, but also in my career. It kind of translates into my career. I have these hyper focused rabbit holes, and then I just disperse into so many different thought processes. And so that's how I kind of approach my work as well. I try to do something with the best of my ability, and then I want to learn more and see more and figure out more. And then while I was at DU, I got to serve our student community there in so many different ways. I was a trustee, and I got elected onto the student government. And I one thing that my freshman year, as an immigrant and international student, and as a person of color, it was DU is a great school. It's not the most diverse school. It is a very, very, rigid kind of institution in terms of its demographics and the population there. And it, it was a huge culture shift for me when I first came to DU. And I noticed very early on that there was very little, I was not part of the conversation of when the university was being created. Like, it was not made for people like me. And I saw that the systems there were not made for people like me. And even though, like, after the fact, there was efforts being made to make it for people like me, it wasn't made for us. We were not who, who they thought of when they were building it. And it was that and that there was that disconnect between the resources and the folks who needed it the most.
Mm.
And that's where I worked with the team of other students at DU to establish the Multicultural Alliance, and we were engaged in a lot of on-campus organizing and program development and activism. And I was very, very involved while I was on campus in a lot of these. In a lot of different ways, the student union and Multicultural Alliance. So I was the executive director the last 2.5 years of my undergraduate career there. And I think DU was a very unique experience. And my whole undergraduate years, I towards the end, my senior year was when the pandemic happened. So I got to experience that as well from a very unique perspective. That's when I went back home to Oman. I was working for the New Gulf Ophthalmological Foundation as their health equities coordinator. It was again, like, after having lived here for 2.5 3 years at that point, and then kind of going back home was a very interesting shift. So I got to take all of these skills and experiences and lived experiences from Denver back to Oman, and then kind of compounded with all of the new stuff that I was learning from Oman, living there during a pandemic. And then coming back to Denver right after, I was working for the Denver Department of Public Health and Environment. So I was in a public health department at the peak of COVID. So it was a whole other ball game. It was I was at the front lines of the front lines, and it was so fascinating and so terrifying. It was now it is fascinating. Now I enjoy talking about it, but back then it was like scary, and it was heartbreaking, really, to see the disconnect we had in resources, the disconnect we had among our communities, the disconnect we had in services. And that is where, I know we are going to talk about Colectivo, but that is where a lot of my future approaches to public health also, I was able to really, refine it, crystallize the way I wanted to approach my career and my practice as an emerging public health professional.
I love this, and I think well, thank you for sharing that first of all, and I know you started off by saying, like, you came in, you're like, I just want to try out a lot of different things. I want to do all these different experiences, and I feel like that's how you have to be when you're new and learning and wanting to figure out like what you like, because you might find passions in places that you
Mm-hmm.
never knew
Mm-hmm.
existed. So it is really about getting that experience and putting yourself out there. But I wanted to dig a little bit into, you said that you had these like student leadership roles at the university because you saw the disconnect in resources and how those were allocated to the people that
Mm-hmm.
actually need those resources. A lot of us see that in
Mm-hmm.
places that we go to school.
Mm-hmm.
What was the thing that made you take action or made you say, like, I want to be a part of this solution, or like start to have this conversation?
Yeah, I mean, I am not somebody who sits down. I don't know how to put my head down. I don't know how to be quiet. Like I said, I've been doing this since I was 12 years old. Um, my earliest experiences was organizing, in a war zone. So I have that. That's the lived reality I bring into every conversation I go into, and seeing that disconnect, my question is why, and why not something better, right? Why isn't a better possible? And if it is, why don't we have it? And so it's up to us to get it. And I think, and there's a lot of, I would say, like, as I was a lot younger then, which comes with a little bit of over enthusiasm and a little bit of naivete as well, because
Yeah,
I'm
yeah.
like, I'm going to fix this. I'm going to end disparity. I'm going to end racism, and I'm going to make sure, completely eliminate xenophobia. And yeah, so that's not how it works. That's not how it works. But I did not. And there's that over enthusiasm that you have when you're, in your teens and early 20s. So that, coupled with my experience and coupled with my I would say, like, dogged stubbornness, is what really made me want to do a lot of the things that I did, and I don't regret doing them, because each experience, as difficult and as testing as they may have been, taught me so much that makes me the person I am today, and taught me a lot of strength and resilience, a lot more than I had known until that point. Because when you are trying to work to reform and rebuild a system, kind of, essentially from the scratch, it is such a Herculean undertaking, that, and there's so many forces working against you, that it is the kind of thing that really builds character, really builds strength, really builds resilience. And I am very glad that I got the opportunity to do that. Even more, I'm very glad that I had people I could collaborate with in that work. I wouldn't have been able to do any of that by myself. So I was very lucky and privileged and honored to have had those co-conspirators, to have had those partners, that were able, who were willing and able to get out in the field with me, and who stood shoulder to shoulder with me, who co-built these ideas and these projects with me. So without them, I wouldn't have been able to do any of it. And many of them are still some of my dearest friends. Yeah, so I'm very glad that I got the chance to do all of that, and more so to do it with them.
You heard it. Go find your conspirators and work towards solving those solutions. But love that, love that. So, from all those experiences that you've spoken about, both lived experience and work experience, and really diving
Hmm.
deeper into public health and really where you see yourself in this work, it led you to be the founder and president for Colectivo de Paz. So,
Hmm.
can you tell us more about this organization, why you started it, what you'll do?
Yeah, I love talking about Colectivo. Colectivo de Paz, it began from the work that I was doing on campus. And as the pandemic started, and I was working at the Department of Public Health, did DDPHE, and then on campus I was organizing a lot of these, food drives, community food pantries, and vaccination drives, and creating public health education material. And as a new immigrant, as an international student and a new immigrant, I noticed how little resources were, that were supposed to be for, immigrants and refugees, were actually reaching me. And one of my closest friends, he's a refugee from the Democratic Republic of the Congo, so he from DRC, and him and I, we would get to talking about, there are these nonprofits doing such important work here. There are these healthcare organizations doing work, there are these other, private individuals doing work, but they don't reach to the to the capacity that it could, to the extent that it could, the people that it's supposed to reach. And that was a troubling thing for me, because already historically underserved and historically marginalized communities and individuals are at such a systemic disadvantage in accessing equity, or in even dreaming of accessing equity, because there are so many systemic barriers that are built between now and that equality, right, between now and that equity. And even when these resources are being created by the community for our community, it is not reaching the people it's supposed to reach, and that's not okay. That's not okay. So we wanted to create more autonomy and more self reliance and more self efficacy for our community in both accessing these resources that were meant for them, and also liberating the resources and systems that weren't. So, how do we get there, right? How do we get there? We are just, some 20 something year olds, just in college seniors. How do we get there? And that's the question. And I was just beginning my career in public health. I was still in college, and I wanted to explore ways of leveraging my experience, my lived experience as an immigrant, as an international student. And I have the privilege of being able to go to college. I have the privilege of having access to spaces and rooms that a lot of my peers, men of color, queer men of color, immigrants, refugees, international students, third culture immigrants don't have. And I felt this responsibility to do something with it. And I was talking to my friend, and we were brainstorming different community projects we could do. And every day I would, we would make little goodie bags and go out. I had this other friend, she and I would pack goodie bags and go out on Colfax, which is a huge thoroughfare here, street here in Denver. It's actually the longest road in the United States, Colfax. So, and it was the historic heart of Denver. Now it is almost, predominantly immigrant and refugee communities, mostly communities of color. Um, it's also full of small businesses and culturally, rooted businesses from all parts of the world and all parts of America. Yeah, so we were talking and looking at these disconnect, and we would make, just as a community, we would get together. We would, me and some of my friends, we would cook. We would make little snack boxes, some food, some hygiene kits. And this other friend of mine, Claire, who's still to this day one of my closest friends, the two of us would go out on Colfax, and we would distribute these food packets and hygiene kits to our community members. We would sit down, we would talk. I was having immigration issues at the time. I had just lost a job on campus, like teaching assistant situation that I was very, very looking forward to financially, and it was taking a toll on me financially. And I was really worried that after my undergraduate degree was done, what my visa situation was going to look like here, especially because I was doing so much, and I was still, building things in Denver. I didn't want to leave just yet, and I was very stressed about it. And it was while we were out on Colfax, we would talk to community members who had those very similar stresses. We were working similar jobs and having similar conversations. There were families who had the siblings detained, their kids detained, their parents who were stuck in a different state. There were immigrants and refugees. There were people who looked like me, who looked like my mom, and we would sit down, have a cup of coffee. We would talk when we were having these conversations about this deep wound at the heart of the city that we had all come to love. And we knew that, as someone who was passionate about healthcare, I wanted to heal that wound. And again, the over enthusiasm of how young I was then, but it is that kind of built Colectivo. I remember coming home from one of these outreach drives with Claire, and as soon as we got back, as soon as the two of us got back to campus, I walked to the dining hall. I was got dinner, and I was sat down and I was sketching on a piece of napkin, and I was sketching, and this idea came to my mind that these resources exist, these communities exist, these opportunities exist. We have the ability to bridge these gaps. We have so many nonprofits. Denver actually has one of the largest nonprofit per capita in the United States. And that's crazy to me that even with all of these groups doing such valuable work, we were seeing so much disconnect. We were seeing so much disparity. So, how do we bring them together, as a collective? And that's the collectivo part to attain peace and stability. And the you can't have peace without liberation, and that's the paz, collectivo de paz, a collective of peace. And we attain that peace through collectively liberating ourselves and collectively developing the strength and the resources and the tools for advocating for ourselves, to building that self-efficacy, right? And so we were sitting there, and I was having dinner, and I remember this idea coming to my mind, and then I knew I had to do something about it. So I was part of a leadership program at DU, and they gave us some funding, some opportunity to talk about this in a classroom. And I approached Claire first, and then I approached my friend Methuselah, who's the friend from the DRC that I mentioned. And then I approached a few other friends of mine, people that I knew were like-minded, who understood, had that lived experience, or had access to that, to people who have had that lived experience. And sitting down with them, we started kind of approaching. I want to approach this very systematically, and I grew up with my grandfather, who was very inspired by the works that the Black Panthers did in the United States, the work that the Brown Berets did in the United States, and as well as the work that several community organizations and student groups did in India as he was growing up. And I wanted to, approach this with that mass line perspective. So we went out to the community. We did several community town halls. We did several community health assessments. We asked our community members, immigrants and refugees, underserved Denverites who were facing this disproportionate brunt of an unequal system, how can we make it more equal? What does health mean to you? So we were asking the question that you're asking me. We were asking those same questions, very similar questions, to the people that we were living with. And so we were asking them, what does health mean to you? What does well-being mean to you? And we were writing down these answers. So I did a mixed methods needs assessment for a service area that includes 3 zip codes. And then we did several town halls. And after that, I brought together this group of friends and co-conspirators that I mentioned together, and we sieved through this data, sieved through the feedback we've got from our community and our own lived experience. And then we developed our bylaws, developed our mission statement, and then we started going door to door, canvassing, door knocking, trying to create more community buy-in for this idea, see if it would work. Did it have legs? And it did. And it did. And in our first year, we were able to distribute upwards of 7,000 meals to unhoused residents of the city of Denver. Our unhoused community members. We were able to distribute 7,000 freshly cooked meals. And that's not including the non-perishable meal packets that we distribute throughout the week. This is the just through on the weekends when we cook and distribute. And then throughout the week, we distribute non-perishable food packets. We started doing street medicine. We started building after-school programs for our young people, especially people who had interactions with the carceral system. We started working with community advocates and community leaders and elders who have been working for a more healthy, equitable, meals at schools. Who are working to expand food, EBT access for kids during the summer breaks. Who are working to disrupt the school to prison pipeline. All of these people doing such valuable work. We were able to talk to them, work with them, build with them. And Colectivo currently, so our mission is to provide responsive resources and proactive advocacy simultaneously to underserved Denverites with the aim of creating communities of action. So that is what Collectivo aims to do. And we do this with four services right now. We have our mutual aid program that does our food distribution, our community kitchen, our street medicine, our hygiene kits, all of that great stuff. We have a resource navigation team that provides resource navigation, case management for unhoused immigrants and refugees who are needing resources for healthcare access or legal access and all of that good stuff. And then we have our youth program called USync, or Urban Scholars Youth Network. And we provide after school programs, we provide workshops in high schools about community organizing and community power building. We teach kids to make healthy food, healthy meals on a budget when you're using EBT food stamps to buy food. How can you still cook healthy, nourishing meals in like a 15-minute window? We teach kids to write resumes, after high school, what are their plans, pursuing 4-year college or 2-year programs, finding mentorships. We have a mentor mentee program. So all of that in the youth wing. And then the last part of our service is our proactive advocacy piece, where we are advocating at the state capitol on more progressive legislation that can improve health equity for all Denverites. So we have been so through these four pillars, we have been trying to address get to the root cause of a lot of disparity, and I would say with great success and very encouraging results that it's always so humbling to be a part of. We have helped upwards of 1,200 Denverites so far, and over the last year, we now distribute an average of 10,000 meals a year. So it's very, very encouraging and very exciting to be a part of.
Appreciate you sharing that, and like kudos to you for like, I guess, sitting down in the cafeteria that night and writing down that idea and then actioning on it for it to come to all of this great work. And like, firstly, I want to say, like, because I think it's so important to share this story and share that perspective, because even if someone wants to do this on a small scale in
Mm-hmm.
whatever community they are, they have the means, they have the skill sets to do like the focus group, the needs assessment,
Mm-hmm. Mm-hmm.
understanding needs, to build the relationship with the people in the community and really find out what are the things that they need. And then, like, that in itself is a public health work that you can be doing now as an independent project if you really wanted to. And then to that point, branch out, create nonprofit, create whatever that might look like. But I'm
Mm-hmm. Mm-hmm.
just like, there's that so much potential in there for so many of us to make that change. And like, firstly, like, I'm really glad that y'all are doing all the food distribution and all of that, and like you mentioned numbers there, but like the thing that's so important to me, and I think so often is missed from like nonprofits and in this work, is while we do need to serve the immediate needs of the community, is how are we, to your point, doing that proactive
Mm-hmm.
advocacy so that we necessarily don't have to deal with this issue. Let's focus on another issue that the community needs, because we've gotten the policies, we've gotten the systems to change, to give those people the equitable access to those resources that they need. But yeah, this is awesome, and I'm really glad that you like took this upon yourself to do this, and I think it's really meaningful, and I think this is what we need to continue to do as public health professionals, and with the skill set as a public health professional,
Mm-hmm.
to do more and, like, I don't know, build your community. Yeah, anything else you want to add to that?
No, I touched everything. I think I touched a lot of different things that influence the creation of Collectivo, but also what gets us out of bed and why
Yeah.
we do the work we do, and the results that we've been able to see, and and such encouraging response from our community. And I'll add this though, is that one of the best, more than the numbers and more than anything else, is there's a story that is the biggest metric for me for the success of Collectivo, is that in our first few months of work, we ran into this community member while we were doing distribution. And she was an immigrant who had just come into the US a few years prior to that day. And her partner was detained in Texas. and her son was in a youth shelter here, and they had fled their home country in hopes of a more equitable world and a more equitable community, as they were as a queer couple with a kid. And as soon as they got here, as soon as they crossed the border, they got separated. They got separated so far and so systematically that the our community member that we were talking to, she was devastated. And for the last since they came to the US, and it was a few years at that point, she had been trying so hard to no avail. And so we were able to sit down with her and talk to her lawyers and then work towards an action plan. And 6 months from then, we were able to, reunite her son with her. And then we were able to take them to Texas to meet, meet her partner. And then a few months after, we were able to get a stay for her partner. And then they moved back to Denver. And once they got resettled, we started working on a transitional housing program for them, which had them rehoused. And a week after that, they showed up to our community kitchen to volunteer, and they have not stopped since. Both the moms and their kid, they show up every single week. And it is the greatest thing to know that you're part of that story, to see the three of them smile, and to know that you had a tiny part to play in that smile. My grandmother always says that as long as everything you do is in defense of smiles, you're doing something right. And seeing the three of them together, that's what I feel like. And that is, I would say, the greatest thing that has happened to me through collectivos, that I've been able to be a small part in so many of these stories. This is one case, but we have had so many of these cases where we have been able to play a small role in bringing people smiles. And there is nothing more important for me than that.
Oh, that's beautiful. That's beautiful. And before we move on, were there any undergrad takeaways that you wanted to share?
Be curious, and try out as many things as you can, no matter how crazy they might seem in the moment, as irrelevant they might seem to what your larger plans of what you're doing and how you want to do it. If you think something is intriguing, something is interesting, try it out. There is a learning opportunity everywhere, and don't underestimate those learning opportunities. I have learned the most unexpected things in the most unexpected places that have been lifesavers for me. And I think a lot of people can relate to that. So just try out as many things as you can, and let your heart and your mind and your creativity and your curiosity flow free. And also be observant. There is a lot of things going on, as you're a young person. There's a lot of things going on around you, and you have all of that energy and that potential. So just be observant, be creative, and let yourself feel and let yourself breathe.
And then you went on to pursue a Master's of Public Health with a concentration in Community and Behavioral Health from Colorado School of Public Health. Tell us about that thought process.
It was a lot more simple at that point, because I had been doing Collectivo for a year and a half at that point. I just gotten out of college. I was working in a public health role, and I knew that I wanted to learn a little bit more the scientific, like I said, the skills, the resources, gain some more of that experience. So I decided that I'd just do it. So it was a lot more straightforward. Colorado School of Public Health is such an amazing school. And even before I did my MPH there, I have had the opportunity to partner with some professors there. I had the opportunity to partner with several of their students, and I had seen the impact of their work in our community. And I knew that, that's the space I wanted to find myself in. So I applied, and yeah, and then that was that.
And while you were there, you had a couple different positions. You were the Public Health Administration and Research Intern at the Denver Department of Public Health and Environment.
Mm-hmm.
You were an Education Equity Scholar at the Morgridge College of Education at the University of Denver, and you're also Community Outreach and Enrollment Director for Sheridan Health Services. So tell us about those experiences.
Yes, so I worked with the Denver Department of Public Health during the pandemic, and I got another term limited internship opportunity there. I had a great experience. I mean, very stressful, but a great experience working with the team there. And so I wanted to I would say, like, polish a little bit more of my public health, tools in my arsenal, flex a little bit more of my public health muscle, learn some more. Like on the field. So I did that, and then I got the opportunity to. So the Education Equity Scholar, it was back at DU's Graduate School of Education, which is a mortgage school, was doing this program here in underserved high schools, specifically for neurodiverse young people. You know, as a neurodiverse person myself, I wanted to just be a part of that conversation. And it was an after school program providing support on literacy, math, and science. And so I was able to be there, help out with some reading assignments. Just I love hanging out with the kiddos and talking, and they had so many wonderful insights about so many different things. And on
That's
my
real.
it is. And on my last day there, actually, one of the students gave me a balloon that said, "Thank you, Mr. Sudev." And to this day, it's in my office. I always look at it every morning because they taught me just as much about public health as my professors did. And it is no shade to my professors. It's a huge compliment to them, actually, because these kids were some of the smartest people I had met, and they were so curious and so creative and so brilliant. And I always think, we have all these ideas when we are that age. We have all these passions when we are that age. And as we grow older, we teach ourselves to be realistic. We teach
Hmm.
ourselves to, numb those edges. And
Right.
um, I think that is a great disservice to ourselves, because we rob ourselves of the opportunity to do truly wondrous, miraculous things, that these kids, to them it's just a Tuesday, but for us, we don't think that way. And so they taught me in a way to kind of, again, approach public health with that curiosity in mind. And it is a learning curve for me. I'm going to admit that it's a learning curve, but I am very glad that I got the chance to talk to them and work with them, because even though it was for just a few short months, I still take those lessons with me every day. And then with Sheridan, which is a federally qualified health center, it was again a term limited opportunity. It started out as my practicum for my MPH, but then I loved the office and the folks there, and they loved me, and we had such a great rapport that when they were hiring somebody for a term limited role for their community engagement and enrollment coordinator, they considered me, and I'm very grateful they did, because for the next few months I got to build out their community engagement and enrollment department. I got to design their mobile health unit. I got to work on their community health impact plan, their service area competition grant applications. So I got to do a lot of the administrative part of public health, which I had not gotten really the chance to work with to that point. So I got to, really work on a lot of those skills and hone those skills. And I think, again, like I was saying, try out everything. And I'm still doing that, and I hope I still am able to do it late into my career as well. That I'm able to experience, because health is such a multidimensional vector, and to experience working in healthcare from as many different angles as possible. Because as healthcare professionals, I think it's very important for us to develop a rounded understanding of health, disparity, equity, access, and um, look at it and tackle it from all sorts of different perspectives. And all of these opportunities that I was able to pursue while we're doing my MPH really contributed to that. Also, I did my capstone during my MPH on bullet injuries, so gun violence and bullet related injuries, which is completely different. My during the day I was working with elementary school and preschool. During the day I was working with my, with the kiddos, and then I would spend several hours after in level 1 trauma centers working on bullet related injuries and thinking about, so I was working to see possible causes of attrition in hospital based violence intervention programs. And that was my capstone research. And I was doing a literature review and an evidence analysis. And I also got to learn from Dr. L.J. Punch, who does very similar work in St. Louis, Missouri, um, and work with the folks who are doing very similar, harm reduction and violence intervention programs here in Denver. So those were all really great experiences. I got to experience, I would say, several different factors of healthcare and health, which I'm very, very grateful for.
And then looking back on your Masters of Public Health experience and the experiences you had while you were doing Masters program, what were some of those takeaways that you wanted to share?
Um, no problem is too small and no problem is too big. Working on gun violence and bullet related injuries, especially, it can seem such a insurmountable problem, right? It is so heartbreaking and difficult to hold on to hope, and difficult to hold on to a purpose when you see a public health epidemic that is so rampant and that so disproportionately affects black and brown young people, black and brown young men. And, seeing faces and bodies like mine and like some of my closest friends, seeing and knowing the scars and the wounds that it was leaving on my community, it's a very heavy burden to work with. So it can, problems like that in healthcare, we are working with the most sensitive of issues, with the most changing and rapidly changing and dynamic environments, with the most burden of change, and I think it can get exhausting, and it can seem very Herculean. And if you don't look at it in a step by step approach, if you don't look at it in, taking it one day at a time perspective, it's very easy to burn out. It's very easy to burn out. I had several points during my MPH where I was on the brink of burning out, and I wanted to just, sit down and scream. And it is important to, at that at those moments, hold grace for yourself as well, to know that you're a person, that you have your limits, that, it is important to forgive yourself for your your inadequacies, however you might perceive them, to forgive yourself for those, and to hold space for growth, and to see these problems as, something that you cannot solve in a day. You take it one step at a time. It's like the serenity prayer, knowing having the courage to change the things that you can, and the serenity to accept the things that you cannot, and the wisdom to know the difference, right? So I will never say accept anything as it is. Do not accept systems that are broken. Do not accept systems that need fixing as they are. But also understand that these problems are larger than you and larger than me, and they require patience, and they require persistence. So you cannot burn out today, because you need to be out here tomorrow, and you need to, be able to live to fight another day. So holding that grace for yourself is something I really had to learn, to forgive myself and let myself grow into the gaps that I was finding myself in, was something I really had to learn.
That's important, I think, especially in this type of work, because as you're saying, like these the issues that are around us, the problems that exist around us, have been built up decades because of the systems that are there, and they're going to take decades to be rebuilt or broken down. And to your point, it is like we can't be martyrs to this work, because we need to be here for the long run in supporting all the different ways that we can in the work that is needed. So appreciate you sharing that there. And before we move on to the Furious Five, I'd love to know, where can people connect with you, and where would you like to see yourself in the future?
So, where can people connect with me? I am on LinkedIn and I'm on Instagram. I am pretty quick to respond on both the platforms. So, I would love if anybody wants to reach out to me on both platforms. My handle is HRIDX Sudev, Hridith Sudev. And so, I would love to hear from. I always love to hear from other, public health professionals, from other community organizers, folks who are on the front lines of building and rebuilding our systems to better benefit all people, to create a future that is more equitable, that is more just. It is not something that any of us can do by ourselves. It takes a community, it takes a collective. And so, and you never know where you're going to find your co-conspirators, right? So I love to hear from people, from all, as many different people as I can, because I learn from every interaction. I think I learn from every interaction I have with every person. And where I would like to see myself, um, I would, I like where I see myself now. I think in right now, or in 10 years, or in 50 years, I want to know that I'm doing meaningful work. And I want to know that every day when I wake up and I'm going out and, doing something, it matters, that it's making life just even a teeny bit better for at least one person, that it's putting smiles on at least a person's face. And I think, human beings, we have that bone of altruism. We are inherently altruistic. I think there is inherent kindness in us, and that if, as long as you fight and work to defend those smiles, people tend to pay it forward. And there are these, and there, I have seen these chain reactions of kindness happen and occur. And I think, as long as I know that I am part of those chain reactions of kindness in my community, as long as I can see myself be a part of those positive changes, I'd be a very happy person.
Let's continue the movement to defend the smile. I like that a lot. And now moving you on to the Furious Five, the five questions I ask all guests. Number one, what advice would you give to a student pursuing a career in public health?
Ooh, I think I gave a few already, um, but let me think. A student pursuing public health, I would say, get a strong foundation in epidemiology and health policy. So if you're going to study public health, those are, I think those that perspective really helps you understand things from a political and policy kind of perspective, which is a very important part of public health. And also from the biochemical, medical, the STEM part of the question as well, and looking at it from both the social and the bio, chemical, the medical part of it, is a very important way to look at all of these different vectors of healthcare. So get a strong foundation in epidemiology and health policy, and I would say gain as much practical experience as you can. Do as many different things as you can, and try out as many different areas as you can until you find something you're passionate about, and then specialize in that. Really work on honing those muscles, flexing those muscles, really build those skills out. And network, always talk to as many people as you can. Every interaction, every conversation with other, folks doing similar work who are also on the front lines with you, is a learning experience. So I think never pass off on any of these learning experiences, because you never know where you're going to get that spark, that oomph that you're looking for, that you can carry forward with you for the rest of your career. So just keep your mind, eyes, ears open for that at all times.
Number two, if you're talking to someone wanting to get into your position, what
Mhm.
advice would you give them?
um Talk to the people that you want to serve. So if you know what specific public health question you want to answer, or public health area you want to get into, take some time to think about who is part of that conversation and who isn't. For whom are the systems built and for whom aren't the systems built for. And then talk to people from all of these different, all these different sides of that question. And try and see where you can fit. So being mindful of your positionality as a public health professional, I think is very, very important. And just kind of crowdsourcing that direction for your work. It can be a little bit, it's very easy to get into defensiveness, especially if you're approaching a community or a problem that you don't have a lot of lived experience in. So just being holding space for that growth, holding space for that change, and crowdsourcing your direction as a public health professional, especially if you're getting into leadership and you want to have a community centered approach to leadership, then making sure that your work is resonant with the needs and the wants and the opportunities of the people that you're serving. So just being mindful of your positionality.
Number three, what's something you're working on improving in your life right now?
Ooh, I would say work-life balance and a little bit of more time management. I would love to. I haven't sat down and read anything in a while. I would love to do that, and I know that I can do it if I make time for it. So I need to find some more time for my work-life balance and just holding a little bit more grace for myself. Like I said, it is an upwards battle. It's a learning curve. To sometimes you have that martyr complex when you're doing the work you're doing and you're so passionate about doing it. You can have that martyr complex and you can really burn yourself out because you want to solve everything and you're willing to burn yourself in that process. So holding grace for yourself and holding patience for yourself and being kind to yourself is something that I have a lot of difficulty doing. It doesn't come naturally to me. So I'm trying to learn that and I'm trying to work on it. I've been working on it for a bit now, but it is a learning curve.
Love it. Number four, professionally, do you recommend anything?
Um, oh my God. There's a few books that I would recommend for sure. If you're going into public health, and there's this amazing book by Dr. Jamila Missioner. It's called Fragmented Democracy, Medicaid Federalism, and Unequal Politics, I think. I have that book on my bookshelf over there. It's one of the best reads to understand how a public health solution like Medicaid, is influenced by and then goes on to influence public policy, politics, public dialogue, and how that
Hmm.
impacts other public health perspectives and rhetoric on public health as well, and the impact it has in both numbers and in human experience.
Hmm.
So, I mean, Dr. Missioner does an incredible job looking at America and America's burden with race and disparity and inequities, and how we can work towards deconstructing these very difficult situations, and to rebuild something more equitable with more justice and more liberatory lens of healthcare. So it's an amazing read. There is also this other book that I love. It's called Flatlining, and it also looks at how economy influences race and racial and economic health disparities. So it's also a great read. So anybody who's trying to get into public health work, especially working with underserved communities, I would say those two books are a great place to start. And there's also, I have a reading list and I have some videos I love that I go back to all the time. But
Feel free to share that with me afterwards, and I could link that, or we could find ways. But
of
definitely
course.
appreciate those recommendations. And then number five, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
Uh, I would say never blame yourself for being curious and never regret the risks you take. And I'm going to leave it at that.
Love it. Hridith Sudev, this was a wonderful conversation. Connected with you in so many different ways. Enjoyed this and learned a lot as well. I appreciate you being a part of this show and coming on and sharing your story.
Thank you so much for having me. I have not talked to a lot of people who lived in Oman, so it was wonderful to connect with you. Also, somebody in public health, somebody I look up to, and have had great conversations with. And it is so crazy to know that you are have also lived in Oman. So that's But thank you so much. Thank you so much for having me.
Yeah, truly, truly, it's my pleasure. I look forward to staying connected.
Absolutely.
Housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to hit subscribe if you have not as yet. Share it with a friend. Leave a 5-star review, and see you all next week. Peace, everyone.